there are two main problems of acromegaly. So first of all, let me define acromegaly. So acromegaly is a disease that in the vast majority of the cases, I would say 98% of the cases, is caused by a tumor, a benign tumor in the pituitary that secretes GH, growth hormone. And G8 leads to an increase in IGF-1. That is the hormone that promotes the vast majority of signs and symptoms of acromegaly. And one of the problems of the disease is that many people and also many physicians are not familiar with the disease. So the disease has many signs and symptoms, as I said, so the increase in hands and feet, the features, the face is more, I would say, different, increasing nose in the lips, so hypertension, diabetes, arthralgia, and paresthesia, the risk of colon cancer, so many complications. So these patients go to the cardiologist, to the rheumatologist, to the general practitioner, but nobody's think about acromegaly. So it's a disease that many people is not familiar. So this is one problem. The other problem is that the disease is very insidious. So it's a slow and progressive disease. So people that are very close to the patient don't realize that the patient is changing. So, but for example, if the patient meets someone that he or she doesn't see for many years, this person will notice that that patient is very different. But people don't know what's happening. And this change in appearance is associated with a lot of loss of quality of life because the patient doesn't understand what's going on, but he feels ugly, he feels fatigue, he feels bad, but he doesn't understand. On top of that, hypertension, diabetes, arthropathy, so a very slow growing and debilitating and aggressive disease. Regarding to mortality, if the disease is not controlled, the mortality is increased maybe 1.7 up to 3 times the normal population. So we need to control the disease. I mean, we need to have normal IGF-1 and G8, mainly IGF-1, but ideally also GH. Otherwise, this patient is in risk of having precocious mortality. So these are the main problems of the disease. The primary treatment of acromegaly is surgery. So the patient should be referred to a referral center. It's very important that the patient is operated on in a referral center. And one of the definition of a referral center is a center that has a neurosurgeon that does at least 1 pituitary surgery per week, I mean 50 per year, ideally 100, but, and also the center has to have a neuroendocrinology and the whole team. But, so the primary treatment is surgery. Surgery will cure the patient in approximately 50% of the cases. These in referral centers, because if it's not in a referral center, it could be close to 0 or 10%. But in referral center is in average 50%. So this means that the other 50% will need more treatment that are usually the drugs. Radiotherapy is reserved for more aggressive disease because the patient may get some important complications with radiotherapy. So we reserve radiotherapy for more aggressive tumors. So usually when the patient is not cured by surgery, we put on them in drugs.